With my first baby, I laboured spontaneously at 41 weeks, and laboured at home for a short time and then came into hospital. I had an epidural for pain relief, but I was progressing quite slowly, and ended up having a syntocin and a drip popped in just to help my contractions speed up a bit or become more effective. Didn't really work too well, so I therefore had an emergency caesarean section at 9 centimetres for failure to progress, really. So 2 years later, I had my second baby. I was really keen for a vaginal birth, so I had some acupuncture at 36 weeks onwards. I laboured spontaneously at 40 weeks, on my due date actually, and laboured at home quite well. My waters broke about 4 centimetres or so, came into hospital shortly after, and needed some pain relief, so I had an epidural. Laboured pretty well. Soon after epidural insertion I was fully dilated and was pushing, but needed some assistance, so I had a ventouse birth. With that second birth, as it was a vaginal birth after caesarean section, so a trial of labour, I had to be monitored quite closely, so with a CTG monitoring, just to check baby's heart rate, and I had to also have an IV cannula put in, so a drip. So for my third baby that I have just recently had, it was again a vaginal birth after a caesarean section, so a trial of labour. After having acupuncture from 36 weeks, I went into labour at 38 weeks and had a pretty quick labour, and managed to push my baby out on my own with no assistance, which I was absolutely thrilled with.
I had a woman just recently who had a previous caesarean section because her baby was lying breech. And when she fell pregnant this time, she made contact and said, I absolutely do not want to have another caesarean section. I want a vaginal birth. So we talked about all the pros and cons and what would be required. She was determined, absolutely determined. Nothing was going to stop her. Her due date came and her due date went, and she still showed no signs of labour. And we talked about going overdue and what she wanted to do, and she said, well, I'm really happy to wait. So at 41 weeks plus 3 days, we went to the hospital to have a post-dates assessment done, and everything was fine. The placenta was fine, there was enough fluid around the baby, baby's lungs had good breathing movements, it was moving well otherwise. And so she said, I still want to wait. And so we waited. We were then coming back on the Monday, which was 41 weeks plus 6 days, so just short of 42 weeks, to come have another post-dates assessment. And that night she went into labour, the night before that 41 weeks plus 6 days assessment. And she laboured beautifully. She did have a little bit of meconium liquor. We did all the things that are recommended, like a cannula in, constant monitoring, her labouring in hospital, and she birthed this beautiful over 4 kilo baby vaginally, and she was thrilled to bits. So again, it's sometimes the determination of a woman that will lead to the success.